and the most pleasant good day to each and every one of you today, and thanks for joining us once again here at the Information Command Center at the studios of the Government Information Service as part of our command, our response to COVID-19. Of course, you can follow us each and every day on the Government of St. Lucia Facebook page, as well as on the YouTube channel and on NTN. We are also joined each day by WVNT 93.5. So thanks once again for being with us every day. Today we'll be discussing living with sickle cell amidst this pandemic, as well as its Lupus Awareness Month, so we will be talking about this on today's show. We're also celebrating our nurses as part of International Nurses Day. So for those of you listening to us or hearing us, viewing us right now, if you know a nurse, please reach out directly, or we can all express gratitude to our nurses, our frontline workers at this time by posting something positive for them on our Facebook page, Instagram, Twitter, what have you. International Nurses Day is an international day celebrated around the world on May 12th each year. It is the anniversary of Florence Nightingale, who is named as the first modern day nurse, and the contributions nurses make to our society is celebrated each year on this day. We take a listen now to a message from the president of St. Lucia's Nurses Association, Ms. Alicia Baptiste.
The World Health Organization, WHO, confirmed in May last year that 2020 would be dedicated to the nurse and midwives, providing a once-in-a-generation opportunity to showcase them. It chose the theme to coincide with the 20th anniversary of the birth of Florence Nightingale in May this year. Arguably, nursing has moved into a global spotlight in a way that calling it the Year of the Nurse never would have. The response to the pandemic showcased to the world that nursing really is saving lives. 2020 is an opportunity for nurses to better explain what they do, to break the myths around nursing, and to advocate for investment in the profession. In order to explain what nursing is, we need to look back at how nursing started, what we have learned from the founders of modern nursing, and what the key attributes of nursing are that make it stand out from other healthcare professions. As the largest group of frontline health professionals caring for the health needs of individuals and communities, nurses have powerful stories to tell that can help to bring about positive change. A supported and empowered nursing workforce is an effective solution to the problem of improving health outcomes. Nursing is at the core of enabling health systems across the entire world to achieve high quality, accessible, and affordable health care. Through sheer weight of numbers, our scientific reasoning, and our proximity to the patient, we are nursing the world to health. Thus, our theme this year being Nurses, a Voice to Lead, Nursing the World to Health. 2020 is an important time for nursing. It provides the opportunity to clearly demonstrate to policymakers, health professionals, and the public about the enormous contribution of nurses to health and well-being, the roles and responsibilities of this vital profession, and to shatter the perpetuated myths and stereotypes that have afflicted the profession for far too long. This is our moment. Let us seize this time, not just for the sake of nursing, but for the benefit of our world. This was intended to have helped make the case for better support, better investment, and better resourcing of the nursing and midwifery professions. Yes, Year of the Nurse plans have changed. But look at what is happening with COVID-19 and the nursing response to it, and how actually it is highlighting and showcasing and profiling lots of things that we wanted to achieve out of the year of the nurse and midwife. Not in a way we would have wanted. None of us would have wanted it this way, but this is our reality, and this is what nurses are doing. Each of the nurses working with these patients is potentially putting their own health at risk. And we know that many nurses are contracting the virus around the world despite their best efforts to keep themselves safe. Governments need to acknowledge the role of nursing in the front line against the virus, and we need to put nurses right at the center of our planning and of the support we are providing. Nurses are also suffering from issues around breaks, psychological support, and lack of financial compensation for the hours they worked. As an association, we would like to highlight the need for ongoing support once this crisis is over, due to its pressure and demands. We need our leaders to keep listening to our nursing input at a senior level to help with the response and inform policies. We urge Ministry of Health to support nurses and other healthcare workers in the front line, both at work and in quarantine, by ensuring that they have adequate rest periods, sufficient personal protective equipment, and psychological assistance. They are key partners who are rightfully demanding a seat at the top policy-making tables, bringing an invaluable clinical expertise and, through their membership, a direct line to key intelligence on the ground. As NNAs, we play a vital role shaping, improving, building, and developing health systems. Their expertise, advice, evidence, and direct contact with grassroots nursing is an essential part of the successful management of these outbreaks and of others in the future. In addition, NNAs are playing a critical advocacy role on behalf of the nursing workforce worldwide to ensure their support and protection. Nurses, please continue to adhere to protocol and protect yourselves at all times. It is maybe one of our most challenging periods, but with our resilience, we will conquer. As I close, as nurses, we need to feel a sense of accomplishment. We are going to feel very tired and exhausted, but today, we all should take a moment to feel immensely proud of our choice of profession. And remember, we are a voice to lead, nursing the world to health. To all nurses, I salute you. Take a bow.
And we say a very special thank you to Nurse Alicia Baptiste for that message on International Nurses Day. And we salute our nurses today and always for all that they are doing for us. Before we get into our topics for the day, the daily updates on Monday, May 11, 2020, results for 55 samples were received and they were all negative. This brings a total of 675 tests conducted to date. St. Lucia has recorded a total of 18 confirmed cases of COVID-19. 17 are fully recovered and have reintegrated into their communities, and one active case is currently in hospital care and recovering well. And as the government continues to ensure that nationals are returned home due to unprecedented crisis, 20 more nationals who are employees of Carnival Corporation arrived here on Tuesday, May 12, 2020. As per protocol, they were transferred to a quarantine facility where they will remain for 14 days. They will also be tested for COVID-19 during the quarantine period. We would like to take this opportunity to wish them all the best. At this time, we take a break, and when we come back, we will be joined on the line by Dr. Cleopatra Altino of the St. Lucia Arthritis and Lupus Association. Stay tuned.
Because of how quickly the coronavirus spreads, each new case calls for increased public vigilance. Know what is happening, understand why, and comply. Think of the protocols as war tactics. Personal protection tactics. Keep 6 feet away from others. Avoid riding the bus, gathering on beaches, in bars, and shops. Public protection tactics. Quarantine yourself if you feel fluish in case you have been exposed. Call 311 or a respiratory clinic for advice. Country tactics. Partial lockdown. Supermarkets, small grocers, pharmacies, and ATMs are accessible before curfew. Total lockdown. Everywhere stays closed 24/7 for a stipulated period. Team tactics. Don't only follow the protocols, be a protocols police. Let's win this.
Together let us win this war. Said we shall be a soldier. Together we can beat this corona.
With all that's happening around us, simple adjustments are necessary to keep us all safe. When calling 911, we may need a little more information to deploy the right personnel and protocols. You may be asked about your travel history, signs and symptoms, contact and movement history, and whether others in your household are exhibiting similar symptoms. Please be patient and cooperative during this time to ensure you receive the best possible care while keeping our first responders safe.
And welcome back. As I mentioned earlier on, we are observing Lupus Awareness Month, this month here in St. Lucia, the month of May. And joining us on the line right now, we have Dr. Cleopatra Altino of the St. Lucia Arthritis and Lupus Association. Sunday, May 10th was observed as Lupus Day, and May, as I mentioned, is Lupus Awareness Month. And as the rest of us, the association have had to put in place the protocols for members during COVID-19. Welcome, Dr. Altino.
Hi, thank you for having me.
And how are you doing today?
I am doing well, thank you. And you?
I'm doing fine. Okay, so maybe you could begin by telling us a little about the Arthritis and Lupus Association.
Okay, so SLALA, so St. Lucia Arthritis and Lupus Association, that would have been founded in 1997. Dr. Amanda King and some others organized the association because we saw a need for not just lupus patients, but persons with rheumatic disease, so arthritis, and there are many different types of arthritis, and there are many types of autoimmune disease as well. Lupus is one of them. And they thought there was a need to have an association to help patients get support for each other, to support each other, and to also help bring about awareness of those conditions within St. Lucia and I guess within the Caribbean as well. So SLALA has been there since then, and May, as well as you said, May is World Lupus Awareness Month, and the 10th was World Lupus Day. So every year for the last 2 years, I think SLALA has been trying its best to come out bigger each time with activities. This year was obviously not the same because of COVID, and so the activities we had planned, we had to kind of put them off. But we found new ways, and I think it's probably good as well that we learn new things and we can incorporate those new ways as well into the activities we would like to do.
Okay, so for those of us who are not aware, what exactly is lupus?
Okay, so lupus is an autoimmune condition. It is chronic. There are different types of lupus. So whenever we just talk about lupus, usually we refer to systemic lupus, which is the most common type, and that is the type that can affect every part of the body. So it's autoimmune because it is the body's immune system fighting against itself. And if we understand the immune system, it is our army. So it fights viruses and bacteria and all of those things. So we expect it to work against outsiders. Whereas if autoimmune conditions, it's fighting against itself. So that is not something that we expect to happen. We don't know what causes it, unfortunately, but we do know that there are things that can contribute to it and influence it. So there are triggers, for instance, like the sun is considered one. So there's some patients who will let you know that when they go out in the sun, it makes them worse. Infections, there's a lot of research on that as well in terms of different infections that could be possibly triggering lupus. Hormones, so we think in terms of, because women tend to get lupus more than men, and there is a thinking that perhaps there is some likeness to the estrogen hormone that women have. Some antibiotics can cause lupus, and in those cases it would be probably like a drug-induced lupus. So maybe when you stop the medication, it goes away. There's also discoid lupus, which is, again, so that's separate from the systemic, and that is the one that affects the skin mostly. So they would get, those patients tend to get a lot of like hair loss and rashes on their face, on their neck, on their scalp, that sort of thing. So usually when we just say lupus, we're talking about the one that affects any part of the body.
Okay, understood. And how exactly is it diagnosed?
Okay, so that, I guess, brings us to the symptoms. So if systemic lupus, again, because it can affect every organ, you can get symptoms from any part of the body. So the diagnosis is largely from symptoms or signs, as well as blood investigation. So the blood investigations would be looking for, because we mentioned that it's an autoimmune condition, right? So we're looking for these things called antibodies, which is what we make when your immune system is fighting something and it recognizes it, it marks it. And so we make antibodies so we can remember that this thing should not be here. So you can make antibodies against yourself. So there's a test you can actually do to check to see if you have these antibodies. So that's ANE. But in terms of diagnosing it, it's more looking at symptoms along with these blood tests. So it's not just one test. So one of the things that we would like, if the person has a rash, and especially people may be aware of the butterfly rash that we talk about. So butterflies would be like a symbol of lupus. So it's a rash across the cheeks. Usually persons get it in the sun, or they could get what we call a discoid rash. So it's a rash usually in sun-exposed areas. So you'd find it on their arms, in the collar of their neck. If they have sores in their mouth, if they have the sun sensitivity. So in terms of, they would actually tell you that when they go out in the sun, they get rash and redness. So they're sun sensitive. They could get chest pain. Usually it's a sharp pain when they breathe in. And that's usually because there's inflammation around the lining of the heart or the lung. They could get inflammation in the kidneys. That one you may not get symptoms necessarily unless it's late, where they might get swelling of their feet, which would be like kidney failure type symptoms. But if you go to the doctor or the health center or whatever, and they check the urine and there's protein in it, or one of the things persons would know, if there's a lot of protein in the urine is foamy. So that's something to be aware of as well. If they have problems with their blood, so whether the blood count is low, the hemoglobin or the platelets are low, or the white cell is low, that's any of those things. It's like they count as marks to help you see if they have criteria for it. Arthritis or joint pain, as we say. So usually they would have pain or swelling as well in some of their joints. They can get their, we say the nervous system. So some persons may present with seizures, or some persons may even present with psychosis. So like changes in their behavior, so that they're behaving as if they're mad. Sometimes it could be just depression. So those are symptoms that you would look at, and if the person has like 4 of those along with the antibodies, then you would consider that they have lupus. And there are lots of other tests that you could do as well. But once you can sort of pick those out, then you sort of move with the diagnosis and try and manage it.
Okay.
Even though it's not in the diagnosis, what they've noticed is that a lot of lupus patients complain of fatigue, and it's like like an unexplainable tiredness. So like they sleep and sleep and sleep, and they still wake up feeling tired. And some patients will tell you like they would come with family members, for instance, and they might be labeled as lazy because they always want to sleep. But sometimes that's a very significant symptom that a lot of them have, as well as fever or even weight loss or hair loss.
All right.
So
Now,
those
since
are
there seems
things
to
that we
be
look at
no cure, no treatment to get out of this, how is it managed?
Okay, so we would say there's no cure right now, but we say there's treatment. So one of the things which I guess where LALA comes in is in terms of awareness. So in most countries of the world, they would say it takes an average of 6 years to be diagnosed with lupus. And that is because I'm sure from what I've said to you, all of these symptoms, somebody can have any of them at any time and you wouldn't even know that it's lupus, right? So sometimes people have joint pain. I mean, they call it fouety, and it comes and goes, or they have a rash, or they have, things come and go. And if they're not aware, they might go on like that for years before somebody actually realizes that's what's going on. Because of, if you have awareness, if people are aware, so as we're talking about this, and we're talking about what to look out for, and persons are aware that those symptoms can be possible signs of lupus, then they can present earlier, and they can be tested earlier, and you can see what's going on, and then we can manage it well. We can treat it. So one of the medications that is used basically for all lupus patients, unless they have a problem, is something called Plaquenil. And we probably would have heard of Plaquenil in this time because it's hydroxychloroquine. That would have been the drug that early on in this whole COVID thing, everybody was supposed to take it to either prevent it or treat it, right? But lupus patients depend on Plaquenil to help keep them well. It's a mild drug, but it's a really good drug. It has been shown to help prevent flares. It helps prevent kidney, like nephritis, so inflammation of the kidneys. It helps with cholesterol. It helps with blood sugars, so if you're diabetic. It helps the tiredness and the chest pain and the joint pain. And so some patients may very well, just from taking the Plaquenil, feel so much better that they don't need anything else. But if you have a patient who is there's more inflammation going on that needs to be managed, so whether they have kidney inflammation, then they need more than Plaquenil. So there are other drugs we call immunosuppressants that we would have to use. We use steroids sometimes. We try not to use too much steroids because we know that they can cause bone thinning and high blood pressure and diabetes and stomach ulcers, and we try not to use too much of those, but everything has its role, and those would be medications. But and I guess that's where again SNALA would come in, because SNALA can't offer its members medication so much, but we can offer a lot in terms of lifestyle and advice and things like that. So managing your lupus is a holistic thing. So it's not just about taking your tablet. It's about managing. So there's something, patients get like flares. So it's like they might be doing really well, not feeling like they have lupus at all. And then all of a sudden maybe the joints will start acting up, and you would call that a flare. And things like stress can cause persons to flare, or if they have an infection or something. So stress management is a big thing. And managing stress is for everybody, right? So making sure you get enough sleep, making sure you eat well, so healthy food, wholesome food, as much natural foods as possible, and we have the opportunity now to do that. So, growing our own food and all of that, getting enough exercise, and I guess there's a balance as well, so not overdoing it, but getting regular, consistent exercise to help you to feel better, because that has been shown to help tiredness more actually than anything. And then SNALA has been like for years now with the Stanford University, the self-management, the chronic disease self-management program, which SNALA renamed Disease Year, is a 6-week workshop for anyone, but especially for members, to learn how to manage themselves better. So in terms of how to cope with pain and make better decisions and communicate better with their doctors, so not just stop their medication, but let the doctor know what's happening with them and make decisions together so that they are the ones in control of themselves. Because we as doctors, even though we have the information and we know what to do, we can't make people do it, right? So if each person who has whatever condition they're dealing with, they can understand what's going on with them, manage it themselves, get the doctor when they need, make sure they're doing the exercise, make sure they're eating well, then you can actually have quite good management of any condition. So it's not just for lupus, but for diabetes, high blood pressure. Once we understand why we're doing it and what our goal is in trying to manage it.
Right. In light of COVID-19 and the pandemic, what would you see the susceptible level of a lupus patient is amidst all of this?
Okay, so lupus patients, so when we talk about a vulnerable person, lupus patients would definitely be in there because it's an autoimmune condition. And if we're talking about with COVID, that being an infection, and I mean, we can see that it really does attack your immune system. So if you have somebody who has lupus whose immune system is already compromised, we really want to protect those persons. So from very, very early, so I work with Dr. Amanda King, who's our rheumatologist, and from very early, we let our patients know that we want them to stay home because we did not want them coming out just to seek medical care. And so as much as possible, doing teleconsults with them and trying to help manage them and help them manage themselves as well, because they would be the ones to make sure they're taking the medication, even though they're not out, make sure they're getting some exercise, make sure they're eating well and all of that. So our lupus patients are very much in the vulnerable population, and so they do need to be protected and to be as much of the social distancing and all of the etiquette in terms of hand washing and all of that. So it's very important, and we've been trying to get that message out there to them so that they make sure they appreciate that.
Okay, bearing in mind the social distancing and some of the other protocols, how will some of your activities for Lupus Awareness Month be rolled out for the rest of the month of May?
Okay, so as I said earlier, it's quite exciting, I suppose, because we kind of felt as if we couldn't do anything, and then all of a sudden we realized that we could. And so Slala has actually been helping well, there are other lupus foundations across the Caribbean, and so Slala is collaborating with others. So for instance, there's a Lupus Foundation of Grenada. So on Thursday, so Thursday is normally our meeting day. So Thursday is the second Thursday. At 5 o'clock, we have a Zoom meeting. So we sent out a link to the members, and basically at 5 o'clock they would log on, and then we would meet and chat and discuss whatever it is. But at 3 o'clock in the afternoon, we would be sending out information to our members to join a webinar, which is actually going to be delivered by Dr. King, so our Dr. King, and Francisca Plummer, who's a psychotherapist here. So Dr. King will be doing an overview of lupus, and Ms. Plummer will be doing coping with lupus. So it is another way of members learning about lupus, because normally we have a lupus seminar each year, so we're not able to host that, but that would be one avenue. On Friday, it's Put on Purple for Lupus. So this is a worldwide, I don't want to say celebration, but all around the world it's recognized as Put on Purple. So people put on purple hats, t-shirts, lipstick, hair. They would take pictures and put it out as showing support for lupus. And that can still happen. So, people can still take their selfies and post it to our Facebook page. On Monday, there's again, Slala has co-opted the help of an ophthalmologist from the US. I've forgotten her name right now, sorry. But she would be hosting a webinar at 7 in the evening, so it's 7 to 8. And so from 7 to 7:30 would be for health professionals on ocular manifestations of lupus, and 7:30 to 8 would be for like members and well patients on eye disease and lupus. Then next week, Thursday, we collaborate again with Lupus Foundation of Grenada, and they are actually hosting a yoga session at 4 in the afternoon, and so for our members to be invited to that. And we would have another webinar on the 26th of May, which is the following Monday. We would give out the details. It would be sometime in the evening, but we're looking to have Dr. Merle Clark and Dr. Grandison Didier again do a short talk on like skin and lupus and kidneys and lupus. But that information will be put out. So we're just looking for members to look out for the emails and log in to the online platform, so most likely to Zoom, so they could have access to this information and be able to learn and empower themselves a lot more. And tomorrow night, because Dr. Clark normally does a HealthWise program on a Wednesday evening, so the program tomorrow night will also be about lupus. So we sent her information from members and that sort of thing to air, so that St. Lucia would be able to know and learn.
Okay, sounds good. Before I take in the final word from you, I just want to read out a post from one of your advocates, Sky Alcide, and someone who sort of directed me to your Facebook page and what is happening with lupus here in St. Lucia. And just to read her post, after my diagnosis, in my cycle of understanding this illness, I stopped relying on doctors finding a cure and began to advocate being as well as possible for as long as possible. It stopped being about delaying life until I'm cured, but enjoying the moment while I'm alive. I think this is the best way to live and the best mentality to have when you suffer with an invisible illness like lupus. Be strong, my loopy spoonies. And that message there from an advocate of the Lupus Association, Sky Alcide, and someone who directed me to get you guys involved in what we're doing here at the Information Command Center in light of COVID-19.
Oh, well, thank you. Thank you. We appreciate it.
Okay, so the final word from you?
Final word is I just hoping all of St. Lucia. So we want to thank, so before I say what I want, we really want to thank like Massey, for instance, has really been great in terms of sponsoring, even in this time, because we sort of didn't even send out letters of asking for sponsorship for the month because we realized these are tough times, and they still came on. They have their stores with the purple and information in there, so if you go into the stores, you would see that masks for the employees, so they'll have their purple masks on, so you can look out for that. The SJCT Club has been wonderful as well. They also organized some masks for us to sell, and they created a video, so that would air tomorrow night, all in support of it. We had a Rotary Club of Groseley earlier in like maybe last month or earlier within the whole COVID thing. They reached out to us and asked us if we had any needs like members, because that was during the time of the lockdown. And they were able to provide hampers to some of our members in need. And it was so good to know that even though we could not be together and that we were able to still reach out and help, and it was because of these other persons. So we want to thank, and all of those persons who every year they are usually there for SLALA. So the labs who offer discounts, the pharmacies as well. And yes, we appreciate the pharmacies, because even when all of this whole thing about Plaquenil, hydroxychloroquine came out, they were protecting it. They were making sure that people were not just getting it. They were saying, do you have lupus? So we appreciate it, because there were parts of the world where lupus patients could not get their Plaquenil because other people were just taking it because they figured they needed to take it for COVID. So we want to thank all of these people, and there's so many others who every year, like the Baileys, who every year give us support in terms of fundraising and stuff for SLALA. So I just want to still encourage St. Lucians. I want to encourage our members, first of all, because without you, we are not an association. So I want to thank all of those who have been putting their face out there, because the theme this year was make lupus visible. And some of them, a lot of people tend to be shy about saying that they have lupus because they feel that they might be stigmatized. And some of our members have been so awesome. I mean, they've done videos and put things out there. So we're hoping that would be an inspiration for St. Lucians and help them to not be so judgmental and to be a lot more open-minded and be more supportive. And we want to thank St. Lucians, and we hope that we will get their support as well in terms of things like the Put on Purple for Lupus on Friday and throughout the month of May. And not just in May, but throughout the year, if we have any fundraisers or we put out any requests, or even just to be part of activities to learn more about lupus. And if you know somebody, because we went through the symptoms, so joint pain and rash and chest pain and maybe frothy urine, I will say, seizures or whatever, and you think that they may have lupus, or you think maybe they should at least get tested, because that's the other thing. Sometimes it runs in families, so you want to know maybe if you know you have it and somebody has symptoms and you want them to get checked, you can call the association.
Yes. Okay.
So the association number is 459-0092 or 486-7000, or you can email slala.flu@gmail, or you can go onto our great Facebook page, which is upkept by our Vice President, Shawnette Gabriel, who's doing an awesome job. So go on the Facebook page, like the page, see the information that's on there. You can send a message and say, how can you help this person or refer them, and then you can get some direction and guidance as to what to do. So we just want to say thank you to St. Lucia, and to stay safe. And when you're in all of this COVID thing, you're not just protecting yourselves, you're protecting lupus patients as well. So thank you.
Thank you so much, Dr. Cleopatra Altino, for joining us here on the line at the Information Command Center. And you and your members do stay safe as well. We continue the conversation here at the Information Command Center. We just heard there from Dr. Cleopatra Altino discussing lupus and what is happening for Lupus Awareness Month during the month of May. In studio with us right now, we are joined by Sophia Harry, who is the president of the St. Lucia Sickle Cell Association, and the PRO, Marlon Joseph. And in all the discussions we've been having, yes, we're talking COVID and, the immune system, or what have you, but sometimes we forget that we're also dealing with some of those other vulnerable groups, sickle cell patients, lupus, persons living with diabetes. There's so many other things going on. And today being Nurses Awareness Day, the nurses have so much more on their plate right now and so much to deal with. Good day to both of you.
Good day, good day.
Okay, so let us start by talking about sickle cell. What exactly is it?
Okay, good afternoon. I'll give you a brief description of what the disease is. It's a disease, and it's a hereditary disease, blood disease. It's caused by an abnormality in the red pigment called the hemoglobin, which is responsible for transporting oxygen in the red blood cells. Now, when the red blood cells release oxygen, they may become long, pointed, and they may develop a rigid sickle or half-moon shape instead of a round, smooth shape. Now, when this happens, it makes it very difficult for the red blood cells to flow freely in the narrow blood vessels. Now, this causes pain and many other complications. And it can also cause swelling. You will find that, the children will have swollen fingers and swollen toes. You can also get problems like you can get jaundice, many difficulties.
How prevalent is it in St. Lucia?
Well, in St. Lucia, we have about a little over 600 persons with the disease. And some of them, we have different types. Some of them have the trait, and some of them are full-blown sicklers. Okay?
Give us some background information as to the association.
Well, St. Lucia Sickle Cell Association, this association was founded on the 7th of September, 1987. And every September, we have Sickle Cell Awareness Month. Now, in St. Lucia, what happens with us, when we first started off, things was booming, you know. We had lots of different activities taking place. We had different groups. We were involved in different Caribbean countries like Costa. But now, as of late, with the association, we're just trying to get back on track. We noticed that we have some of our members that they don't come to the follow-ups. We don't have their numbers. So this is one of the reasons why we are here today, to try to reach out to our members and let them know that, yes, Sickle Cell Association is still alive and well. And like our motto says, it's good to know that you care. We're still keeping up to that mandate. And we would like to show the general public out there that we really do care about our persons with sickle cell disease.
And how can they reach out to you? They need to get in touch with you. All
right. So our location, right now we're at an office directly at the back of the Leclerc Catholic Church. And we're open Monday to Wednesday from 9 a.m. to 2 p.m. in the afternoon. And our telephone number is 453-1011. Our cell number is 485-2355. And you could also email us at sscaslu@gmail.com.
Now, Marlon, maybe you could tell me, what have you all been hearing from some of your members or persons living with sickle cell, especially during this time of COVID-19?
Well, people living with sickle cell at this time, it's a little difficult for them because a lot of them, they cannot stay in a job because of the illness. They would be sick often. So some of them would be hospitalized often. So it would be difficult to stay in a job, so that the funds now would be a little difficult. So you would need support. Even when you're at the hospital, you would need support. And at this time where you need to stock up on your groceries and everything, it would be a little difficult. So we have to step in and assist, support them and stuff like that.
What avenues do you guys use to get the support for your members or other persons living with sickle cell?
We normally look for donations from different companies and different people, the general public. We source funds and we assist in any way we can.
Sophia, you wanted to comment?
We do fundraisers.
Yeah, we do fundraisers as well.
Yeah.
But I guess at this time, given what is happening, if all the protocols in place, it's kind of difficult to put some of these activities together.
At the time, yes.
Okay, so what other channels do you see you guys using to reach out, both for the support and being able to reach out to your members? What have you been?
Okay, so one of the things we have planned that we started doing is calling our members at home. So we have a few numbers. We call them at home, we find out what is the need, if they're in need. We also lend moral support. We don't, only help them with medical, but we find out, how they're doing. For instance, we have some young persons. They may be living alone. They do not live with their parents. And they may fall sick. And they will need somebody, just to call. So normally I have a lot of young people calling me at home when they're sick, when they're at hospitals. So we do visitations. And we bring hampers, we try the best way possible. We call our members together because we do have a support group system, a fundraising community. We have our WhatsApp group as well. So we find ways to reach our members. But yet still, what I find is that some of our members, since they were not coming to visit on a 6-month basis, that we lost contact, because this year is making the 2nd year since I became the president.
Okay.
So, we're still working on things, and we're pleading to our members to come forward, share with us if you change your address, you change your telephone number, because we're noticing that many of the numbers we're calling, it's not in use anymore.
Okay. In terms of treatment for sickle cells, is it readily available here in St. Lucia? And are there any deficiencies in terms of what is necessary for your members, your patients? Okay,
well, in St. Lucia, I know for a fact that things have changed. It was not like before where they only used to take penicillin, and so on. Now we have our patients taking things like hydroxyurea, which is working very well for some patients, and we have another one I think they take every five years, pneumococcal. Right now, as I speak, I do have a son who takes the pneumococcal every 5 years, and he's doing pretty well. Yes.
How difficult is it, someone who has a son with sickle cell, in terms of managing this whole situation?
Okay, well, I must say, during the time my son was sick, he was 4 years at the time. It was a very difficult process because they always have to go back and forth at the hospitals. You know, sometimes on a monthly basis, they go back and forth. They get seizures. In the case of my son, he had a stroke. But thankful to say that with my son, I believe he was the first child on the island who did receive a bone marrow transplant. So at the age of 4, he received a bone marrow transplant. That took place in Tennessee. So we do work in collaboration with St. Jude's Children's Research Hospital in Tennessee. And that has been a great success. He is right now 24 years of age, and he no longer suffers with the disease. Okay, so we can say that there is a cure for sickle cell disease, but only on, we'll not just say everybody with sickle cell, here you go, you know, have a bone marrow. You have to be referred by your doctor.
Okay. Yeah. In terms of support, do you guys get support from any of the agencies, say Ministry of Health, or collaborate with those agencies on what you do? Well,
yes, we do. We do get support from the government. We also get support from other entities. For instance, we have CIBC Bank normally give lender support, NIC lender support, First National Bank. Even the Prime Minister, when they have fundraisers, they do lender support. And other small entities, other corporate businesses, they do support us, especially if we're having a children's party. They come forward, I must say. Yeah.
What is your message to your members right now at this present juncture?
Okay, so this afternoon I would like to say to our members out there, some of you may be watching, and for those of you who are watching, I know that there is somebody out there that you know with sickle cell, and that person knows somebody else with sickle cell. So this is how the message can be reached out to the wider community. And I would just like to let you know that you can reach out to somebody. Some of you may have just a trait, and you may be living a normal life and you're happy. You don't have crises like those with the full-blown sickle cell. You can come out to help us. We are in great need of volunteers. We need persons to help us in fundraising. We need counselors. We need healthcare workers. If you're retired and you want to lend support, it's good to know that there is somebody out there who cares. So this is one of the pleas I would like, to bring out there to the public.
What about you,
Yes.
Marlon?
We also want the parents of the children who have sickle cell to come forward as well. Because some of them, they have the children with the sickle cell, but they don't come forward. And we need them to come and join the Sickle Cell Association so that they could receive the card. There is a card you get when you go to the emergency ward that you would get assistance right away. So you need to have that card. And yeah, we want people to support, we want people to be sensitive towards people that have the sickle cell disease, because it's something that may be very stressful in your life because you cannot function 100% like everybody else. So yeah, we want them to come forward and join the association, so you could have your contact, you could come sit with us, we could speak with you and support you in any way possible that we can.
I know during this period we have the children at home, going through their classes and their lessons at home. But during the normal affairs of things, do you work closely with the schools in terms of children with sickle cells who may be attending school? I'm pretty sure when they're down that they tend to miss school a lot, but do you have any relationship with the education system?
Okay. In the past, we had every September when we celebrate Awareness Month, we had doctors coming in, going into the schools, doing the educational programs. This year, we're working closely. We're trying to get these doctors to come back. We're working on sending out emails to the doctors so they can go into the schools, especially the high schools, the secondary schools, where they can have these programs. And as of now, we're trying, like Marlon said, to get the parents, Because when we look for the younger ones, you know, when we have children's party, we don't see many children coming out. So if we can reach the parents, then we'll be able to reach the children.
But talking about parents, as a parent yourself with a child with sickle cells, what advice would you have for the parents at this time, especially being at home with a child who has sickle cell, having to manage the home and do so many things, you know, the staying at home protocols and obeying the protocols? What would you have to say to the parents right now?
All right, here we have some tips for our parents out there. Now, with sickle cell disease, we have to make sure that the children drink plenty of fluids, especially water. Water is very important. That helps to prevent crisis. And if they're going to bathe outside in the river, maybe you may be living near a river, make sure as soon as the children come out of the water that you cover them right away, okay? Because that can cause a serious crisis. If your children has the membership card and it's not updated, feel free to call us. We gave you the numbers: 453-1011, Monday, Tuesday, Wednesday, 9 to 2. Okay, and we can update these cards for you because these cards are only in use, it's 1 year, all right? Now, some of our children now, especially the younger ones, you may not feel like speaking to your parents when you're going into a crisis. You may feel that you're bothering them. And some parents, I know for a fact, they feel as if the children are lazy, they want to do nothing. Okay, please parents, bear this in mind. The crisis, what you go through when you have sickle cell, the pain that children endure, I can tell you, it's not easy. All right, so if they complain about pain, don't leave them home. Okay, take them to make sure you take them to the hospital. All right? Yeah.
We're about to wrap up. We're quickly running out of time. But before you go, just some final thoughts from you, Marlon Joseph.
Yeah, I want to say people with sickle cell, I could say they are high risk. So due to this pandemic, you should take extreme precaution. You know, you should stay home, boost your immune system, eat well, rest well. You know, don't use too much dairy products, don't use alcohol, don't smoke. You know, bring yourself to a point where you feel healthy. Yeah, because people with sickle cell, the immune system is compromised already.
Right.
So they are at high risk.
Is there anything particularly you could take to boost their immune system?
Vitamins, B complex, B6, B12. You know, you take vitamin C, do a little exercise, stay inside, don't go outside. You know, try to be safe. So that would be good if you could be very aware of what you do at that time.
Okay, Ms. Harry, your final words?
Okay, my final words for persons out there. I would say to you, follow all of the protocols, okay? Especially coming from the government and the CMO. These are what you're supposed to be following. We know that out there we have a lot of fake news on what you should do, what you shouldn't do, what's happening. But if you stay focused and stick to what being said by the higher authorities, I believe you will be able to deal with this pandemic better, wisely. And we've been saying it all the time, so you know how you have to take care of yourselves. Wash your hands, and make sure if you're going outside, you don't, go back in with the same clothing on you, try to do changes. And lastly, I would like to say to you that I know this is a very stressful time, and with sickle cell, if you encounter stressful situations, that can trigger, and you can, end up with a crisis. So stay safe, be safe, and follow rules and regulations.
Thank you very much. Thank you, Ms. Sophia Harry and Mr. Marlon Joseph from the St. Lucia Sickle Cell Association. You put out an appeal for persons to get in touch with you, and hopefully the next time we have you here, you'll be informing us that your membership have grown in terms of persons utilizing your services. Once again, we would like to say to all persons living with lupus as well as sickle cell that we stand with you even during this time. And once again, to all our nurses, we say thank you, thank you, thank you for all that you're doing on this International Nurses Day. And just for you, I would like to dedicate the latest effort by Caribbean artists as we say goodbye, as we continue to stand together in our battle against COVID-19. This is a song for you as we close up today. Be safe, take good care, and remember that together we are indeed stronger.
Sometimes it really feels like hope has left us with no option, and then sometimes we get so caught up in what we think life should be, feel we lost it all. Our hearts become slowly feeling so much pain that we can't see past the stormy weather, but it'll get better, 'cause we are stronger than any obstacle. Oh, yeah, we are braver than what we've been taught. We've been taught. Strong, yes we are. Powerful, yes we are. We can make it through every single thing. Every single thing. Fearless we are. We are great, yes we are. We can make it through every single thing. Strong, yes we are. Powerful, yes we are. We can make it through every single thing. Fearless we are. We are great, yes we are. We can make it through every single thing. Sometimes it doesn't feel like there's a light at the end of the tunnel, and I know that we get confused when things are not under control, and although we can't see into the future, and we've got plans, and it hurts when things don't go our way, but we can say that we are stronger than any obstacle. Oh, yeah, we are braver than what we've been taught. We've been taught. Strong, yes we are. Powerful, yes we are. We can make it through every single thing. Fearless we are. We are great, yes we are. We can make it through every single thing. Strong, yes we are. Powerful, yes we are. We can make it through every single thing. Fearless we are. We are great, yes we are. We can make it through every single thing. Strong, yes we are. Powerful, yes we are. We can make it through every single thing. Fearless we are. We are great, yes we are. We can make it through every little thing.
This message was brought to you by Not Nice Records.